Good evening, everyone. This is Dr. Schilling from Sequoia Health, bringing this week's Wednesday Wellness Minutes. And this week we're going to discuss something that's going to be coming to our clinic very soon, which is called PRP, or platelet-rich plasma injections. And that's going to help supercharge your healing. Basically what it does is it takes your own blood, takes some of the most potent factors out of it, and then we bring it back into the joint that might be affected, like a knee or an ankle or a shoulder, or whatever it might be. And what that does is it increases the materials in the joint. They're going to help it heal faster. It's going to increase the blood flow and things like that, because if you know anything about these types of joints that are closed systems, which means they're like nothing's getting in, nothing getting out per se. And so a lot of blood flow does not get in there. So just to understand that when we talk about these joints, we're talking about what are called synovial joints and things like that, like the bigger joints and stuff like that. Oftentimes what people don't remember about these degenerative issues that they're facing, whether it be knee, shoulder, or hip, things like that, is they get worse over time. And unless you do something about it, really what's going to happen is it's going to get worse, and slowing down. Thank you very much, Nissa. All right, so I've been warned. I'm getting to accelerate again, so thank you for the reminder. Think about it this way: when you have a problem in your body, it's often like a check engine light on your dashboard. For those of you who are of driving age, if a check engine light comes on, it's something you want to check. You want to make sure you pay attention to it, get into the mechanic and things like that. If we take some black tape and put it over a red sign, that's not going to be helpful. But that's oftentimes what happens when we take drugs. So let's talk about what our options are available for people with joint issues and things like that. We have anti-inflammatory medications, Tylenol, Advil, aspirin, things like that. So you take aspirin, it chews up your stomach, get ulcers. Take Tylenol, tears up your liver. Take ibuprofen or Advil, and it goes to your kidneys. And so just as a general example. But they destroy the cartilage over time as well. So when this happens is you get even more powerful prescription drugs that you can use to decrease the pain, but it's not stopping the degeneration. So none of the stuff that's covering up the pain, that's taking away the signal, is stopping it from degenerating further. We also know about the opioid crisis in our country. The number one cause of death over 55 years of age is related to opioids at this point in our history, which is pretty crazy. So you can take oxycodone or Oxycontin and fentanyl, and I mean the list goes on and on. But these drugs are very powerful, and they're very damaging to our health and things like that. They're very effective at covering up the pain, but you see the side effects. Another thing that's common are called cortisone injections, where your body makes what are called corticosteroids, which calm down inflammation. People then take a synthetic version of this called cortisone, and they inject it into the joint. And it's really good at calming down inflammation for most people. Some people it doesn't do anything. But what happens is over time it's going to degenerate the joints. In fact, they've shown that you're going to get about 4% bone loss after 4 months of use of cortisone shots. So when in doubt, stay away from that one. Because it can cause osteoporosis, osteopenia, even osteonecrosis, which necrosis means like breaking down, death of the tissue and things like that. Not a good thing if you want to keep healthy bones. What can also happen is that people, when they take these medications, they can end up hurting themselves even more because they're not feeling the pain. They're like, oh man, this is great. I don't feel any pain. Took the pills. I'm feeling great. And all of a sudden, bam, it gets even worse, or they hurt themselves even worse. And it was now even worse than it was before they took the pain meds. So that's a big problem. You might feel better today, but tomorrow what happens? I always ask myself whenever I'm going to eat, drink, or consume anything, I say to myself, is this going to prepare me for tomorrow, or am I going to have to repair from it tomorrow? That's just a good general rule of thumb to ask yourself. When we talk about regenerative cellular therapy, we really want to think about the premise that we're bringing tissues into existence again. It's really taking them and turning them over and helping them heal and regenerating, like eliminating the problem at hand. So it's going to help rebuild, repair, and things like that, the issues that have happened underlying, and it's going to help just solve the problem, if you will. We would also want to look at what caused the problem in the first place, so you don't have it come back again. That was also a major issue, but definitely we want to focus on eliminating the degeneration and the process from there. If you think about lizards, if you cut off part of their tail, they can grow it back. And if you know anything about the human body, we're turning over our cells all the time. I don't have the statistics off the top of my head, but the number of times you turn over cells, your red blood cells are 21 days, they're all brand new. Your gut's turning over every couple days. It's just amazing how our body's regenerating. But as we age, these regenerative cells in our body, the stem cells, they decrease in number because our blood flow, our blood vasculature, our arteries and veins, they decrease as well. And these things sit right on top of the vessels, the blood vessels, because when we find an injury, of course we have blood supply going to those areas. Your brain and your immune system say, okay, we'll detach this, put it in the bloodstream, take it down to the spot where it's injured, and things like that. So this is really important to understand. As our vasculature, our blood flow decreases, the stem cells decrease as well. Now this technology is not new. It's becoming more and more common because there are more and more research studies, which is allowing the FDA and other governmental bodies to become more accepting of it. But Stanford, Mayo Clinic, Harvard, all the different places. There's even stem cell institutes doing research on this. So it won't be too far in the future when the intravenous type are allowed in this country. I would say I can't imagine it being any more than 5 years, but it really depends on how the drug companies play a role in that. But right now it's only joints. People that are doing systemic treatments with stem cells that are actually being sought after or sought out by the FDA and shut down, things like that. But regenerative cellular therapy can offer a dramatic way to improve not only decrease the pain, but dramatically improve the function. And that's just really what we're trying to do, is improve everything. So you have two choices when a problem comes about. You can keep doing what you've been doing and get more of the same you've been getting, or you can try something new, and that's what regenerative cellular therapy is going to be. So it's really defined as a process of engineering and bringing the cells back to life. So regenerate, you can just think of something coming back from the wasteland, if you will. But we're going to focus on providing PRP, which is what this is about, platelet-rich plasma. And later on we'll talk more about the stem cells and how we get them from donated umbilical cords and things like that from libraries. But the goal is to get you the pain relief you need, but also stop the degeneration, so that we can give us some breathing room and give us time to fix whatever is causing the degeneration in the first place, whether it's typically it's a bacteria, mold, fungus, parasite, or virus that's causing issues in the joints and stuff like that. But we get there eventually. So focus on, let's take an example of all the joints in the body. Let's talk about the knee, for example. The average knee replacement, it costs somewhere in the neighborhood of $57,000. And this is probably outdated because the cost of things go up every day, it seems like. Not to mention you're going to have about 3 to 6 months of downtime, complete inactivity or decreased mobility and things like that. So that's going to cause, let's just say you're someone who does tile, okay? And you've been kneeling on your knees for 15, 20 years, and all of a sudden your knee's shot and you have to get a knee replacement. So you're not going to be working for 3 to 6 months. Tell me that's not going to cut into your lifestyle or into your joy and not be able to play with your kids or enjoy life at all. So it's really important. So even after insurance covers what we think it might cover for a knee replacement, you're still going to be 15 to 20 grand as far as your responsibility, because most people have $8, $10, $15,000 deductibles at this point because all insurance has just gone so far over to the extreme. But let's focus on the PRP now, the platelet-rich plasma. So as we talked about, we take blood out of the system, we put it in a centrifuge, and it's called spinning down, and that separates it out into basically the plasma, the platelet, the red blood cells, and then there's some other fluids in there that are useful as well. But if you see a vial of blood that's spun down, there's 3 specific layers, okay? The plasma is going to provide about 3 to 8 times the amount of concentration of anything else of the platelets. So about the platelets, the plasma is going to be 3 to 8 times more. And so that's going to be the bulk majority when it's spun down. You're going to get that PRP. And this is going to allow it to be injected back into your body and be the growth factors, if you will, that you're going to need in order to produce your body and help it regenerate from the degraded state that it might be. Everyone has a different level of degeneration in their body, depending on how long you've had the problem, how long you've been ignoring it, and how long you've been taking NSAIDs and things like that. It'll determine how fast a person recovers and how many PRP injections. So generally speaking, we would look at, if someone's going to do stem cells, they would do PRP injection, at least 1, if not 3, depending on how their joint is, prior to the stem cell injection, and then you're going to have several follow-ups after that. So these are the cofactors and the things that are going to help it accelerate its growth and really help faster. So the blood's drawn, it's spun down in that centrifuge, and these platelets are pulled off, and then it's put into a syringe in a sterile environment, in a safe, closed environment, and then it's injected back in the joint, which we mentioned is going to provide the growth factors that are needed to supercharge the stem cell function. Some people are not going to be candidate for stem cells. It's just a simple fact of the matter. Some people are degenerated so far that it's not a problem, potential. But the vast majority of people that think they are, quote, bone on bone, they're really not that far gone. And under fluoroscopy injection or by seeing things through an x-ray, you can see that there is still some substrate there, some like a foundation, some building block to use to build up that tissue again. So never think that the hope is lost. As long as there's some cartilage there, things can improve. But we talked about pelvic issues. People have pubic symphysis joint issues, sacroiliac joint issues, hip issues, shoulder issues, wrist issues, ankle issues, toes. People that can benefit from PRP are ACL injuries. Most people think, oh, got to have surgery, got to get some type of cadaver tendon in there, got to get some type of support. But a lot of times when you inject a joint that is not totally gone with some PRP, those platelet-rich plasma cells can go in there and start healing things. So it's not a guarantee that everybody's going to need stem cells. People just simply get the PRP shots and bam, they are back in, tendinitis is down, chronic inflammation is lowered, life is good, life is grand again. So just keep that in mind. A couple things you want to consider, whether PRP is right for you, whether platelet-rich plasma is for you. You want to understand if you've had the condition for more than 3 months, that's generally necessary because you want to make sure it's to the point where it's not in an acute state, because you want to separate out acute states, or like within the last 3 months, to more chronic ones that have been going on for longer than 3 months. So sprains and strains, muscle ligament tendon tears, overall swelling, inflammation. I would have loved to have some of this when I was in baseball, when I was a kid throwing the ball. Tendinitis in my elbow all the time, or shoulder. I separated my shoulder in hockey. Just stuff that would have been supercharged. I would have been back playing much sooner than I would have, instead of losing 2-3 weeks or months in the process. So we're going to look at things on physical examination as far as what is causing your issue, like how much cartilage is still in there. Are there any major tears that actually need to be arthroscopically fixed, or can the PRP do it on its own? The persistent nature, like how long have you been taking your NSAIDs, your Tylenol, aspirin, and ibuprofen, things like that. That's really important to understand. We're also going to want to rule out any pathological changes. So if there's, for example, an off chance there's like some type of tumor in the joint, you definitely don't want to be popping some PRP in there, because that's going to cause it to grow potentially even faster. There's no guarantee, but it's possible. So you want to protect against that. So we want to really delay and or completely eliminate the need for any type of surgical challenges. So a lot of professional athletes use PRP, like Ray Lewis from the Ravens, I think it was. Tiger Woods is using that. He's had like 3 or 4 back surgeries now. He's just won the Masters a few months ago, or a month or so ago. Peyton Manning, Kobe Bryant, these are just people that I've read about that have done PRP injections as far as boosting their performance so they can stay at the top peak of their game. So people want to know, are there any adverse reactions from these type of injections? So you might have some swelling from the area of injection. There might be some injury to the site that's injected, only because your body is going to sense that inflammation, and what it's going to do is going to start mounting that immune response. So swelling, tenderness, redness, all the cardinal signs of inflammation, they're going to be present at the site. Most importantly, people that are taking blood thinners and warfarin, Coumadin, Plavix, things like that, those are the people at higher risk. So you definitely don't want to be dinking around with putting in things like that when they're trying to thin out their blood. Okay, that would be contraindicated, as they say, or in fact counterintuitive. You don't want to put blood in when you're trying to thin it out. So it just makes sense. PRP is definitely FDA approved. It's been used in many different types of clinics. So that is definitely safe there. Typically, the benefits of PRP, provided any underlying issues are handled and or squelched out, are going to be permanent. Okay, every one of these tissues has a lifetime, if you will, but they have a window with which they're going to work the best. So when you think about it, your body's going to respond by taking these PRP cells, these plasma cells, and they're going to put them to work, just like it would with a stem cell. It's going to say, oh, we have someone here. It's like the body's general contractor takes this and says, oh, you're one of my worker bees. I'm going to put you to work over here. I need you to create more blood flow. I need you to decrease inflammation. I need you to do this, this, and this. That's what it's going to do in your body. So when you think about it, you're definitely going to have potentially some area, but it should be only localized. There are very few recorded cases of adverse reactions from PRP, because it's your own tissue. It's drawn from the blood, spun down, certain segments taken off, and it's placed back in the body. So it's your own tissue. So you're not going to get a reaction or a rejection of the tissue. So just understand that, provided there's no adverse reaction, PRP can be done many times over. So if you happen to be an ultra marathoner, someone who runs 100+ miles in a shot, you're probably going to need a lot of PRP, and you're probably going to need it over and over. Encourage you to pick a different hobby, but if it's your choice, you have this option to continue to do PRP injections. But ultimately, we want to do it to dampen down the process and get back to full function without the need for that kind of stuff ongoing. But our goal is to get you out of pain. It is to increase your function, stop the inflammation, stop the degeneration of the joints and stuff like that, and help you regenerate your tissues back to what you had before you had that injury. So just as far as next steps goes, if you have interest in this, if you have questions about it, feel free to email us, text us, shoot us a message here. Some people tend to PM, private message us, and with questions, what's it like, how's it going to, how long is it going to take, things like that. But have your questions answered. If you need to come in for a consultation, we'll sit down with you, go over your issues, look at any radiographs or X-ray films you might have, CT scans, whatever it might be. Receive a physical examination to see how bad off is the joint. Is it simply a muscle imbalance around the joint that's causing all your pain, or is it literally a degenerative process inside there? So that's what we would do. So call us for information, email, text, message below, private message, whatever you have to do. If you know people who suffer from joint issues, inflammation, pain, degeneration, they think they have to get knee surgery, shoulder surgery, ankle surgery, hip surgery, whatever it might be, it's very possible they would benefit from PRP and be able to avoid that injection or that operation altogether, which is 3 to 6 months of downtime depending on what you're getting surgically removed or replaced or whatever it might be. Not a lot of people can handle that, or nor do they want to. So the great thing about regenerative cellular therapy is it gives you the results you want and the pain decrease, the joint regeneration, and none of the downtime. So that's really, it's like the holy grail, if there is such a thing, the closest thing, if you will. So let us know what kind of questions you have about this information. Let us know what kind of information you need as far as processing this. Let us know if you want to come in for a consult. We'll talk to you about your challenges and understand your specific needs and give you the information that you need in order to feel fully empowered to know if this is the right decision for you. Okay? So we'll be coming at you next week again, bringing more information. We may take a small sidestep next week because we have one of our active participants asked us about they're doing injections in the neck for people with PTSD. And it sounds like all this is fantastic, but again, someone with PTSD has a traumatic brain injury and it's a traumatic emotional response. So just because you're injecting the neck does not mean you're removing the problem with the brain, which means it's not going to stop the degeneration in the future. So as a result, you want to make sure you're not doing something willy-nilly. So we're probably going to take a sidestep, bring that information for one of our active participants at her request. And so in 2 weeks from now, we'll be back with more information about stem cells and how they can benefit you and all that it can do for you. Okay? Look forward to seeing you guys next week for the Wednesday Wellness Minutes. Take good care.